This explainer video will give you an overview of the MBBS program offered by HKU Med. The goals of the MBBS curriculum are to produce doctors of tomorrow who can deliver effective, humane and ethical medical care and who are committed to lifelong learning. Since 1887, we have achieved those goals and much more, producing qualified medical graduates for Hong Kong, many of whom have gone on to become leaders in different fields and specialities. HKU Med prepares its students with a rigorous program that gives students plenty of opportunities to develop not only academically, but personally. We promote active and student-centered learning, which is supported by a range of e-learning resources. Our problem-based learning approach allows students to deal with real-life medical situations. Early clinical contact and the provision of comprehensive hospital-based, community-based and primary care experiences also mean our students are ingrained with a sense of patient needs and medical protocols. What does it look like to be an MBBS student? The first thing to note is that our curriculum has 4 themes: human biology and health and disease, professional skills, community application, and ethics and professionalism. Learning spans over 6 years. In the first 2 years, students focus on the biomedical sciences curriculum. The third year is the enrichment year, and years 4 to 6 focus on the clinical curriculum. First and second years, biomedical sciences curriculum. At the very beginning of the MBBS journey, freshmen are inducted through a 13-week introduction to the art and science of medicine that familiarizes them with the educational methods and philosophy of the medical curriculum. The biomedical sciences curriculum focuses on the skills for self-directed learning and critical thinking and basic clinical knowledge. Topics include introduction to human sciences, professionalism and clinical skills, precision medicine, medical humanities, ethics and law, and medicine and society. Students will also learn about caring for patients in a social context through community visits. In the second semester of the first year, students start learning about the different systems of the human body. There are 6 system-based blocks which cover the cardiopulmonary and renal systems, gastrointestinal system, musculoskeletal system, head, neck and nervous system, hematology, immunology system, and endocrine and reproductive systems. These blocks span 47 weeks until the end of Year 2. Alongside, students will also be attending language courses and the choice of common core courses on the main campus. Third year, enrichment year. In the third year, all students will embark on a personalized enrichment year to fulfill their learning ambitions beyond the MBBS. They may opt to do a research attachment, or go on exchange, or do an intercalated degree at HKU or an overseas university. They can also take part in humanitarian work with NGOs overseas or in Hong Kong to serve the needy. 4th to 6 years, clinical curriculum. After this year of exploration, the clinical training begins. Students will first complete a 10-week clinical foundation block to integrate and consolidate the knowledge they acquired during their junior years and get prepared for the clinical curriculum. Students will also study a variety of clinical cases that reflect prevalent local health problems. Clinical rotations then begin in Queen Mary Hospital and other hospitals, as well as in ambulatory care and community-based primary care settings. Students will be directly involved in the day-to-day care of patients. Much emphasis will be put on clinical diagnosis, treatment and patient management. Altogether, students will complete 100 weeks of clinical clerkships. Assessment. To progress to the next year of studies, MBBS students are required to undertake a summative assessment comprising knowledge-based examinations and a clinical assessment at the end of the academic year. For enrichment year, assessment will be in form of a poster presentation on learning outcomes achieved and reflections of the learning experience gained. Assessment for the final year MBBS students will take place in February and March every year, after which they will complete a 4-week MBBS elective to explore areas they are interested in through clinical attachments or research conducted locally or overseas. After graduation, internship. On July 1st, at the end of their final year of study, all medical graduates will undertake a 1-year internship in public hospitals. When that is completed, they can practice as licensed doctors in Hong Kong. Check out our website or contact our staff or student ambassadors to know more about us.
Hi, I'm Professor Ivan Hong, Assistant Dean for Admission. In the next 20 minutes, I'm going to take you through the journey of our 6 years MBBS curriculum and tell you why you should be choosing the Hong Kong U Med. And I strongly encourage the audience to type in the questions in the private chat group. We have been constantly modernizing our MBBS program. And recently, we have started the hybrid PBL. The hybrid PBL encourages students-centered learning. And these small group learnings include both seminars, small group teaching, interactive tutorial, practicals, and also teaching clinics. Lately, we have been starting our e-learning approach that includes lectures, animated e-learning videos, and interactive forums. Each lectures will be made into e-learning videos, allowing our students to learn at their own pace. And also we have the end of sessions quiz to help students to revise. In our MBBS program, we also highly emphasize on early clinical exposures in the first and second years at the preclinical curriculum. That allows our students to go to clinics right in the start of the curriculum, and that will increase the interest of our students. Besides, we also have the Clinical Skill Training Center that allows our students to practice clinical skills before entering into the clinical curriculum. Alongside the early clinical exposures, we also have comprehensive hospital-based and also community-based primary care experience, which allow our students to pick up early primary care skills in the curriculum. The third year Enrichment Year program is the highlight of our MBBS curriculum. And there are three categories that the students could be enrolled on during the Enrichment Year. And that include the integration, which is extremely popular, which allow our students to go overseas to take 1 year of undergraduate study that will result in a BSc or a master degree. And students could be enrolled in well-renowned institutes all over the world, including that of HKU, Oxford and Cambridge, Harvard, and many other well-renowned institutes. Another very popular category is the research attachment that allows our students to undergo studies and attachment to well-famous institutes and also well-renowned researchers. The third category, which is also very popular, is the voluntary service that we have provided for our students that they could attach with various NGOs. Besides, our students could choose to combine two programs together. For example, they can do 6 months of research attachment and combine with 6 months of voluntary service as their own wish. For details of the Enrichment Year program, students could find this on a separate video clip on the Enrichment Year online. Ethical principles and humanitarian values are absolutely essential to the training of modern doctors of the 21st century. You will learn about these principles and values that underpin healthcare practice, as well as your professional and legal obligations through the medical ethics and medical humanities programs in the curriculum. HKU is one of the world-leading institutes in research, with more than 120 professorial being named as the top 1% research scholars internationally, in which half of them come from the Faculty of Medicine. Research requires you to develop your own intellectual and analytical skills. At HKU, we strongly encourage our undergraduate students to undertake health research projects that subsequently lead to the publication in a scientific medical journal. The research project could be clinical-based or as a basic science-based research project, and that could be self-initiative or could be done under the supervision of our professorial staff in your enrichment year or in your 6 years elective. Interprofessional education is essential to our modern-day medical students. The faculty has taken the initiative to introduce interprofessional learning early on in the curriculum. That allows our medical students, nursing students, and pharmacy students to learn from each other during their studies, which mimic the real-life situations. The MBBS curriculum is constantly being renewed in the light of emerging knowledge and societal needs. A very good example is the and Zoom learning during the COVID-19 pandemic for our medical students. Now I'll pass the stage to Dr. Kendrick Shi, who is the Director of the Student Affairs, to talk about student wellness and supportive programs.
Welcome to Hong Kong U Med students. I am Dr. Kendrick Shi. I am currently the Director of Student Affairs at the Li Ka-shing Faculty of Medicine. I was a medical graduate of Hong Kong U Med. I graduated in 2009 with my MBBS and also my Master of Research degree. I am currently a practicing ophthalmologist and I specialize in cornea diseases. At Hong Kong U Med, we understand the importance of starting early and starting well in your medical journey. So we are here with you along the way to help you with the challenges and the tribulations that you will face. So for your 6 years of your medical curriculum, we will have different mentors and advisors watching over you. For the first 2 years, these are your preclinical years, and we are focused on helping you adapt to Hong Kong U Med and also your university life. We will have a preceptor watch over you, and these preceptors are clinicians who they themselves have also gone through this medical journey before you. They understand the difficulties in the preclinical year, they understand some of the uncertainties that you have, and they can guide you along the way for the first 2 years. So I want to spend a little bit more time to talk about the preceptorship program. This is a new scheme that we've launched this year, and it is specifically targeted towards helping our medical students to adapt to the Hong Kong U Med program. So the way that we have designed it is that we have recruited teachers who are clinicians themselves, or they are active teachers in your curriculum. So they are heavily involved in a lot of your preclinical studies. We want to create a very welcoming environment so that you have a lot of time to talk to these preceptors. So we're targeting only about 4 to 5 students per preceptor. After your enrichment year, you will have 3 more years of clinical years. And at this stage of your career, you will start to understand what type of specialties you're interested in, what type of career you may want to have. And so what we will have is a clinical academic advisor who will watch you for these 3 years. We will give you a choice of clinical academic advisors, and you're welcome to pick based on specialty preferences and also their academic interests as well. And we made the system to be very flexible so that this mentorship and advisee relationship allows you to develop your skills and your interests in medicine. Aside from our academic team here at the faculty, we also have a student wellness team. Now this team consists of counselors, clinical psychologists, as well as some academic staff who are here for our students, for their learning, as well as their wellness needs. Just to talk a little bit about some of the activities that we do, we have a peer supporter program where our active students can enroll and undergo training so that they can also provide support to their fellow students. And we also have wellness activities and events such as our Mental Health Month in October. And finally, we have a counseling service that is free, that is confidential, and it is there to provide you when you need it. We also want you to know that our faculty campus is welcoming to your learning and your social needs. We also have a learning commons, which is a nice, large, welcoming area where you can spend time with your classmates and also study and also participate in activities. Here, not only will you find our students, but you'll also find academic staff like myself who are here and welcoming to any student who wants to talk. I am sure you are all eager to learn about our admissions, and so here I pass the time to Professor Ivan Hong, our Assistant Dean of Admissions, to continue.
I think most students are interested in what criteria we based on for our MBBS admissions. And there are 4 factors that we based on for our admissions, which include academic performance, your interview performance, your non-academic achievements, and also your extracurricular activities that you are engaged in. In view of the COVID-19 pandemics, our MMI this year will be based on eMMI. Altogether, there will be 6 stations as previous years, which include 5 English questions and 1 Chinese questions that could be answered in both Mandarin or Cantonese. There will be 2 examiners for each student, 1 examiner for 3 questions, and overall there will be 6 stations which include critical thinking, abstract thinking, communication skill, personal insight, ethics, and general knowledge. The first batch of students will be invited for interview in mid to late December. Similar to previous years, our quota for MBBS program is 265 students. And based on last year's results, the minimum score to get into the MBBS program for JUPA students was 42 of best 6 subjects on the bonus score system. The median is 45 and the top score was 51 last year. For non-JUPA students, it's essential for the IB students to have high-level chemistry and for A-level students to have advanced level in chemistry. In terms of the minimum score for IB students, you need to get 43 before being considered for the MBBS program. And for A-level students, you need 4 A stars to be considered. I guess our students will be very interested in the Hong Kong U scholarships and awards. In the year 2019 and 2020, we have awarded more than 1,100 scholarships to outstanding students, which value more than $22 million. For students who have did very well in the examinations, we have also awarded them with more than 270 prizes in year 2019 and 2020. Now I hand over to our students who will share with you their journeys at the HKU Med.
Hi, I'm Adeline and I'm a Year 2 MBBS student. The one thing that I treasure the most about HKU Med is the connections between the students, professors and HKU admin staff. I really like how approachable and friendly they are. I still remember one time when I was walking around on the campus, there's a HKU admin staff walk to me and chat with me. I feel really welcome and happy. More than that, I really like how PBL makes us into like one big family. Like I can build relationships with my classmates and even the professors. The professors are really helpful and they are really caring. They will like teach you about the stuff that you don't know and you can always approach them and ask stuff too. So I really like how HKU Medicine is like one big family, we're all connected. And one of the most unforgettable thing that happened in my HKU Med life is that I went to India for a medical conference. And that was the time that I got to know about different medical students all over the world, and I got to visit hospitals in India. And I think that was a really eye-opening experience that I got to learn about the local cultures of India and at the same time have some fun times and travel around in India with my fellow classmates. I think how HKU Med shaped me into a doctor in the future is by the learning method, such as like problem-based learning and different practicals. And problem-based learning, we got to be a deep thinker and critical thinker. And in this way, we can learn how to solve our problems and even make new problems and solve it ourselves. And in this way, we can learn how to solve different complications in the future. More than that, in practicals, we got to use our knowledge and really apply it. And so better equip us to the clinical years, where we can really use our knowledge in hands. The words of advice that I would give to the prospective students is that life is up to you, that make it counts. Don't hesitate and chase your dreams. As a Year 2 medical students, there's a lot of stuff that I need to memorize and recite. But I think with good time management and planning, I think we could also tackle it really well. So that I think you all can do it if we can do it.
My name is Matthew and I'm a 4th year medical student here at Hong Kong U Med. And a special or unforgettable thing that happened was when I was in 2nd year and I was president of AMSA Hong Kong. One of my main responsibilities was to organize MedStart. And so this was great because MedStart was actually the first event that introduced me to the Hong Kong medical education system and also the medical system here as a whole. So one of the main reasons why I chose HKU Med was for its enrichment year program, as I was able to have a year-long exposure to facets beyond the traditional medical curricula, all the while learning from professors, teachers, students, and most importantly, patients here locally in Hong Kong. And so this past year, I had the opportunity to complete my master's degree in public health in London. And from this experience, I learned about the wider determinants of health and how, as a future healthcare professional, I can integrate this with clinical knowledge and practice. To those of you who are considering medicine, really take this time and use it wisely to consider whether it is the right career path for you, because this genuine motivation will fuel you during tough times when you're preparing for your exams. And of course, best of luck for your exams as well.
My name is Win, and I'm a third-year medical student. And I'd say one of the most unforgettable experiences would be the Asia Pacific Regional Meeting 2019, which was held in the summer of year one. And I think it was really unforgettable, not only because of the social aspect, but also because intellectually I was exposed to a different side of medicine, so public health. And I was able to interact with a lot of medical students from a really diverse background. So from different countries, different cultures, years, and university. I think the best thing about HKU Med is the enrichment year. And I wasn't able to fully appreciate this back in year one and year two, but having been about a month into the enrichment year, I think it has really opened up the world outside of medicine for me as well as other people. Because there's a lot of expectations surrounding how one's medical career would be. For example, our family would expect us to go into a traditional route of being a medical doctor. I think this enrichment year really helps produce a very diverse student body in that some people will want to further specialize and go into fields such as neuroscience and cardiology, while other people would find subjects like politics, economics, or even anthropology more interesting and try to combine that with their interest in medicine. So I think this is a really once-in-a-lifetime experience that is difficult to find somewhere else, and it really helps us figure out what we want to do in our medical career. My advice to you guys would be to step out of your comfort zone and do something adventurous, as cliched as it sounds. This because as I reflect back on my last 2 years, I realized that the things that I enjoyed most were because I decided to just go for it. And I think especially in medicine, where you have this very rigid expectation of going on to become a medical doctor, it's easy to forget that there is a world outside of medicine. And a lot of my peers and friends also realized this, and what they did this year was just to decide to go for something they really enjoy and try to combine that with medicine. And I think utilizing this opportunity to go on EY and other opportunities in your preclinical years would really help you find your identity and not let it be consumed by just medicine.
Hi everyone, I'm Ty. I'm a 5th year medical student. What I treasure most about HKU Med would be the people here, because we're really professional and really renowned doctors teaching us, and we gain really valuable knowledge here. But more so would be our fellow students, because we've built a really good connection between seniors and juniors. Every time we have problems, we have troubles, we can actually seek help from our seniors, and they would be very willing to teach us everything. And we aren't really people that are like so mean as people think we are. We're really like a big family who would be willing to help everyone out and go through this journey together. I think what HKU Med has taught us to shape us to be a better doctor would be the self-learning and problem-based learning. These two are the skills that we really require to acquire knowledge. I really didn't understand problem-based learning when I was a first-year medical student because I thought it was kind of unnecessary. But as I tried to study more on my own, I started to realize that the knowledge that I retained the most would actually be the things that I learned when I ask myself a question and I find out the answer myself. And I think that would be a really important skill that I would need when I'm a doctor in the future, when I don't have any more of these tutorials or doctors to guide me through all these knowledge. All I have would be myself asking questions, teaching myself by problem-based learning. And that would be a really important thing that HKU has taught me. Studying medicine is for sure a very difficult process, and there will be a lot to sacrifice. But as much as you sacrifice, there are also a lot you can gain. You gain from your peers, you gain from your patients. It's all about the satisfaction you get when you know that all these suffering that you're going through would actually help people improve their quality of life and get out of their illness. So be prepared and be ready.
Hi everyone, so let's move on to the live Q&A session with Professor Ivan Hong and Dr. Kendrick Shi. So as we have already received quite a number of questions already, so we will try to answer as many as possible within this 15 minutes, but please feel free to send us the request to meet these professor right after the webinar session and via the Q&A button, and our colleague will send you the Zoom links right away. So let's start with the first question, right? So what would be the requirement to enter the MBBS program from the New Zealand high school taking NCQA exams?
Well, in fact, we really seldom accept students from New Zealand with an A-level qualification. Nevertheless, based on the basic entrance requirement set by the university, we will require students from New Zealand to have with an A-level score, A-level 3 and/or score with excellence for 3 subjects at least. So, and then we will assess them based on their individual merits and also based on their, of course, their MMI's results.
Right. How does it work for someone who wishes to articulate to MBBS after finishing the B-Biomed Science degree? Is the rate of students doing this high or low?
Get it?
Okay. So we do have a number of students who articulate to MBBS from biomedical science. So the last year we had 3 students, but you have to commit this at the end of your second year, because what will happen is that after your second year in biomedical science, if you are successful in your articulation, then you will start in the 3rd year of the MBBS program. So in this way, it will be 2 plus 4. So it'll be a 6-year program.
Right. Will there be a professional qualification attained upon graduation and the compulsory internship assigned by the department?
Well, basically, after you graduate from your MBBS program, you'll be entering in your 1-year compulsory internship. And then automatically you will be registered with the medical council as a medical practitioner. So there is no extra exam or licensure exam that you have to take.
UCAT and BMAT. So is there a threshold for UCAT and BMAT scores, and any changes for the interview format this year?
So because UCAT and BMAT are not compulsory for admissions, so we do not have a threshold score for these two examinations. In terms of the interview format, because of COVID-19, so we are doing an MMI, which is basically online, and you will be seeing 2 interviewers during that process. And so each interviewer will ask you 3 questions, and each will take about 2 minutes each.
And the question on applying MBBS using UKA level result, is it okay if a student takes chemistry, biology, geography, and psychology, and no physics and no maths?
Yes, I think as long as you have chemistry, which is essential, compulsory, but otherwise there's all different kind of combination you can have, at least with 4 A-level subjects together.
So the follow-up is biology. It's
bio is not a compulsory.
Yeah. And what if my interview was successful, but my DSE result was lower than the requirement? So what will happen? How will the admissions be changed or be altered?
Well, I think I think for DSE you have to achieve the minimum requirement to get into our medical school. The interview is important, but nevertheless you still have to get the minimum score in order to get into the MBBS program.
Level of Chinese. So what is the level of Chinese do we expect, for students to get into Hong Kong UMed? And is it necessary to be fluent?
So, okay, I can address that. So I was a non-JUPAS entrance into MBBS program. So for myself, I was in an international school. My Cantonese wasn't, medically fluent, but as long as I was conversational, I could speak and I could listen to Cantonese, then that was the requirement. In terms of if it's for the JUPAS students, so the HKDSE is Chinese level 3, and alternative Chinese GCSE, GCEAS is Chinese grade E.
Yeah, I think Chinese overall is important for communication to your patients in your clinical years. Nevertheless, if you do, satisfactory in terms of your MMI, then it will be good enough. And also, we will have, we will help you along in your first 3 so-called preclinical years to brush up your Chinese or your Cantonese before you get into the clinical years. And of course, for the MMR, you can use either Cantonese or Mandarin to answer your Chinese, so-called Chinese speaking station.
But I think it's most important for the local context. You want to be a doctor who can understand your patients, and most of our patients do speak Cantonese as their primary mode of communication. So it really does help. And not to worry if you're not very, very fluent in Cantonese at the moment. This takes practice, and you'll get plenty of practice during your time here.
Indeed.
Given the current pandemic situation, so it has actually prevented students from getting clinical experiences in hospitals. So what sort of alternatives could you advise for students?
Yeah, we have difficulties to allow our potential candidates to get clinical experience or attachment to hospitals because of the COVID pandemic. Nevertheless, I do encourage students to during the interview to put in terms of what kind of science projects they have been engaged in, and also what kind of previous experience or exposure to all kinds of NGOs, voluntary service, and to put that forward during your MMI. And I think most of you have put down this kind of experience in your personal statement. So again, it's important to answer these during your MMI and to tell the examiners what you have done in previous years. to show that you have the passion to do medicine. Kendrick, what do you think?
So I also agree with this, but I think the most important thing about doing an attachment is actually to understand the Hong Kong medical system. And although COVID-19 has made a lot of these opportunities very difficult, but at the same time, it has also shed a lot of light on the Hong Kong medical system. So I think by keeping up to date with the media, understanding what's going on in the situation, I think it does help in your MMI and also for whether or not you're suitable for coming back to Hong Kong or being in Hong Kong as a doctor.
So which programs are eligible for articulation to MBBS?
Basically, the Bachelor of Biomedical Science and also the B Pharmacy will be eligible for articulation to MBBS. And this year we will have a new program for the B Nursing. There's a special program that again allowing our top B Nurse students to articulate to the MBBS.
Can we choose any subjects we want for intercalation? I suppose, you may be asking about the enrichment year.
So in terms of intercalated degrees, we do have a number of collaborations with overseas universities and also within our own institution. So they include such as Master of Public Health. So these are things that are medical related or Master of Research. But we do have some other areas such as anthropology and also biomedical ethics. So you can see that there is still a sort of medical perspective, but it does allow you a lot of freedom in terms of what you want to intercalate to.
Will there be any shadowing opportunities?
Yeah, we welcome shadowing opportunities, provided that the COVID pandemic situations allow our students to shadow our clinicians in the hospital areas. So very much depends on the COVID-19 situation. But once the pandemic has been contained, I think our students will be able to have attachment during the preclinical years.
So for a degree holder with a healthcare related degree, may I know if I can complete the studies 5 years and what is the selection criteria?
Okay. So this is related to advanced standing. So for our entrance, for our students who do hold existing degrees, we do consider advanced standing. And in terms of what they can waive, that would be the enrichment year. But this would be assessed on a case-by-case basis. So, you can look into it, and you can also, we'll talk to you about this should you be able to join us for MBBS.
For someone who's very keen in research, so will he or she be able to access the universities around the world and to engage in research?
Yes, very much so. I think this is for especially during the enrichment year, where they will be able to have access to well-renowned institutes for the research attachment. And we strongly encourage students to do so.
Yeah, you should always contact any of our academic staff because we do have connections overseas. For example, I've sent some of my students to Singapore and also to Baltimore and Johns Hopkins for overseas attachments in research.
In terms of SAT and AP results, so reaching what level of these will be considered?
For SAT 1, it will be 1,473 or above. SAT 2 will be 760 or above. For AP will be 5.
Criteria for selecting students to interview.
Okay. So this would be dependent on your selection. So the priority that you've given to our program and also to the academic results that you have that you can show us. Well, the objective is to provide as many opportunities for as many candidates as possible.
Minimum score for the IB predicted grade to get a conditional over interview.
In 2020, the predicted grade for IB was 43. But again, this year we have yet to announce that later on. So last year it was 43.
Is it possible to skip the first year?
So,
yeah.
So I wouldn't recommend it. So the answer is no, because I think the first year is really where you can adapt to the university, the style of how we teach, and also the style of how we assess. So The first year is very important. I think if you are a graduate degree holder, maybe the enrichment year might be something that you can skip, but definitely not the first year. It's also a good opportunity for you to get to know your class so that you can mingle with them, get to know them, and have a support group for your 6 years.
How would you actually compare your performance of the Hong Kong U Med graduates to other of the medical schools, and how would you comment on the graduates?
Well, I think overall Hong Kong medical graduate is absolutely excellent compared to other medical schools. I understand there have been some rumors or murmurs regarding the overall performance of our graduates, especially in terms of interns compared to other medical schools. But as far as I know, I've never seen these kind of reports or so-called from official sources, nor do we encourage you to take heed in any hearsay or unconfirmed reports from unknown sources. We take great pride in nurturing excellent clinician or clinician scientists from our graduates in all kinds of medical fields. And of course, most of our top management officials to hospital cluster directors are all HKU Med graduates. And as far as I know, for the recent, the higher education from Times and from other institutes, Hong Kong U Med is actually ranked 28th in the world and 4th in Asia by subjects, and we basically outrank the other cities' medical school, as well as, in fact, we are really top in Asia. And in terms of the so-called the membership examination, our graduates in Queen Mary Hospital, which is our teaching hospital, is always ranked top in terms of the membership examination. And I think Kendrick can share this as well for ophthalmology.
Yeah, sure. So I myself am an MBBS graduate, but I was also given an opportunity to continue to develop my career in Hong Kong U Med. So Hong Kong U Med not only lets you graduate well and start to work, but they also invite you back to nurture you to become teachers yourself. I'd say that aside from just the academic training that we can provide, another important thing is that we do have more than 130 years of history, which means that we do have more than 130 years worth of alumni. And this alumni network is very important. As you'll find in the medical field, who you know, your connections that you have are very important for your future career. Not in terms of people just helping you out, but in terms of your referral network, people that you can rely on to treat your patients. This is really important for your career.
So time is actually running out, so we have to wrap up this session here, but please remember to send us a request if you want to meet the professors live. They'll be around, so just need to send us the request via Zoom or actually type in your request via live chat. So thank you very much, and hope to see you all at Hong Kong Med very soon.
Thank you. And good luck to your exam.
Thank you.